This is Hamza Hussain and welcome to Pakistan Cardiac Society Season 2 powered by Wilson's Pharmaceutical and presented to you by Pakistan Cardiac Society. Today we are live for the 10th match which is between Khan Stars and FIC Fighters. Khan Star has already won their group match and by winning this match they will qualify for the second round which is Super 6 stage. Before diving into the excitement of the match, allow me to introduce the expert panels who have joined us today for this match. We have today with us Professor Mohammad Isaaq Saab. Professor Mohammad Isaaq Saab will be the match umpire of this match, and we also have with us Professor Hafizullah Saab. And Professor Hafizullah Saab has been a very integral part of this season 2, and we are very thankful to him for being part of this match as well. And we do have with us the General Secretary of Pakistan Cardiac Society, Dr. Fawad Farooq Saab. He is Professor of Cardiology at NICVT Karachi. And meanwhile, last but not the least, we have. I would like to introduce the moderator of this program, Dr. Hamza Ghauri. Dr. Hamza Ghauri is working as Assistant Professor of Cardiology at RSC Rawalpindi. And I will now hand over the mic towards Dr. Hamza Ghauri to start the formal proceeding of this program. Thank you.
Thank you very much, Hamza. So we are back again with another match of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. So today we have another league match. It's in fact the 10th match of the league. And we have Aga Khan University Hospital Stars versus Faisalabad Institute of Cardiology Fighters. So we also have amongst ourselves the panel of experts, and I'm going to start with Professor Hafizullah Saab. He's there. It's always great to have him. His comments, his views are highly appreciated along with his experience. We do have Professor Fawad Farooq. He's also in the panel and he's always as vibrant as ever and instilling a lot of force and impetus to the show. Last but definitely not the least, the umpire. I think he's the one who keeps the balance intact. It's our umpire, Professor Mohammad Isaaq Saab. So welcome, sir. Welcome to the dignitaries. And I would now like to, and Abdul Hamid Siddiqui, I think Professor Abdul Hamid Siddiqui Saab has also joined us. So he's with us as well. Another umpire of the game who has been there to support the show. So with this, I now move to the two teams and the captains of the two teams to go with the introductions. And I will first of all move to FIC Fighters. Do we have them? The captain to please give the introduction. FIC Fighters, please go ahead. So, we can't hear you.
My name is Dr. Wasim Ahmed. I am fourth year resident cardiology application at Faisalabad Institute of Cardiology. I am presenting captain of this competition.
Okay, so and your team members?
I think captain, you can introduce your team members.
Okay, so the captain can introduce the team members. Please go ahead.
Team members को
Assalamualaikum. I'm Dr. Zaif, captain of FIC Fighters, and this is Dr. Super, Dr. Wahid, and Dr. Wasim. These are my team members.
Okay, so thank you very much and best of luck to you for the game. And now, Aga Khan Stars, can we have the introductions from the captain?
Assalamualaikum, I'm Dr. Umair Javed. I'm the captain of the team, and to my right is Dr. Akil Mahmood. He's a senior resident R5, and to my left is Dr. Anna, who's an R4, and wish good luck.
Thank you very much. I think best of luck to you as well. We are hoping for a wonderful game, and as we all know, it's a bright sunny day here in Islamabad, and I'm sure it's the same over there after a lot of rain. So we do expect a high scoring game. And with this we move to our coin toss, which is going to be electronically done. So can we have the toss? Yes. And I'm going to randomly ask one of the teams to call it. So we'll start with Aga Khan Stars. Heads or tails?
Heads.
Heads it is. Roll it. And it is heads. Well, the luck has favored you. You won the toss. So two questions. The first one, you're going to throw the questions or you want to take the questions?
We will throw a question first.
You want to?
We want to throw the questions first.
You want to throw the questions. Okay. And with this, we are going to give you the second option to choose from. Case A or case B? What's your choice?
Case A.
So the news from the center is Aga Khan University Hospital Stars, they have won the toss, they want to throw the questions and they have chosen case A. Alright. So on your screen we have the first case, the first A, and I'm going to ask the team to start reading it. And
So this is the case of a 55-year-old gentleman who with pre-morbids of diabetes, hypertension, and history of primary PCI to alleviate 12 months back is admitted under general surgery care for elective cholecystectomy under general anesthesia. The patient is vitally stable, reports that he feels generally fine, can carry out most of his day-to-day tasks, can climb one flight of stairs, however, has to stop for a moment to catch his breath while climbing the second flight of stairs. His examination reveals a resting heart rate of 90 beats per minute.
Please show us the history. We cannot see the history. We are seeing the speakers. Can you show us the history, please?
Professor
Sir, just pin the cardiac super league window. You have to pin the cardiac super league window.
Okay, yes sir, you'll have to pin it.
मुझे आवाज सही नहीं आ रही. I think there's a problem with the volume.
Yeah, if you want to see
Is
this
it clear now?
question, you have to pin that screen. So just pin that screen, that will be your prime screen.
Please
Shall
carry
we-
on.
Fighters, they are also requested to pin the screen.
Okay sir, so do you have the screen yet sir?
Yes, please. That's perfect.
Okay,
Let's
fine.
go
So,
ahead.
right, sir. So, please continue, and I will request all the others to keep the mics muted. Please read the question.
So this is a case of a 55-year-old gentleman with pre-morbids of diabetes mellitus, hypertension, and history of primary PCI to alleviate 12 months back. He's admitted under general surgery care for elective cholecystectomy under general anesthesia. This patient is vitally stable, reports that he feels generally fine, can carry out most of his day-to-day tasks, can climb one flight of stairs, however, has to stop for a moment to catch his breath while climbing the second flight of stairs. His examination reveals resting heart rate of 90 beats per minute, blood pressure of 142/90. Chest and cardiovascular examination is unremarkable. ECG show sinus rhythm with Q waves in the anterior chest lead. An echo shows LVEF of 40%, which is an improvement of 5% in the comparison to previous echo. His lab parameters are unremarkable except for creatinine, which is 156 millimole per liter. His list of medications. Can you please move the next? Can I have the remaining scenario, please?
So, his lists of medication include aspirin, atorvastatin, dapagliflozin, metformin, and losartan. And can you see the whole case scenario? FIC?
Yes, it is up to losartan.
Okay. So, AKUH and both the teams. I am asking both the teams. Can you see it up till losartan, the whole screen, the whole vignette?
No, sir. We can only see it till the medications. His list of medications. That's.
Can you see it now?
Yes, now it's visible. So his list of medication include aspirin, atorvastatin, dapagliflozin, metformin, and losartan.
Okay, so FIC, you've got a couple of seconds to gather yourself. Let me know when you're ready. And then we'll start with question number 1. So, are you ready? Okay, so let's take us to question number 1. Okay, Khan, please read the question.
So question 1 is, what is the functional capacity of the patient? Option A, 2 mats. Option B, 3 mats. Option C, 5 mats. Option D, 10 mats. Option E, none of the above.
Alright, timer starts now. 60 seconds to answer the question in. Come on, FIC fighters. FIC, we can't hear you. Is your mic muted? Okay, so we've got 25 seconds. What is your choice? Okay, D delta.
Delta 10.
Because we can't hear you clearly, so D delta 10 METs. Is that right?
Yes.
Okay, so lock option D delta 10 METs. Oh. So never mind, you've missed the first one, but I think I want to address this to the technical team. We can't hear FIC properly. The voice is too dimmed. Okay, so I'm sure the technical team is on it. With this, we now move to question number 2.
So question number 2. What is this patient's cardiac risk score estimated by revised cardiac risk index? Option A, 1 points. Option B, 2 points. Option C, 3 points. Option D, 4 points. Option E, 5 points.
Alright, your timer starts now. So it's as per Lee's index or revised cardiac risk index. These are two names for the same risk score. Come on, fighters, we're looking for a 6 this time around. $20 seconds. Come on.
Option is D.
D for Delta.
Option is C.
Okay, Charlie, 3 points. Alright, so lock option C. Yes. Well done. That's out of the park. We start and we're on the board. Well played. Alright. Moving to question number 3. Please read the question, please.
What is the estimated rate of perioperative MI, pulmonary edema, VFib, cardiac arrest, or complete heart block? Option A, 0.9%. Option B, 2.4%. Option C, 6.6%. Option D, 7%. Option E, more than 11%.
And your timer starts now. Okay, less than 20 seconds now.
Beta 2.4%.
Option B, 2.4. You want me to lock it? Beta 2.4. Lock the option. Oh, another one which is missed. An outswinger, I believe. Well, never mind. We move to the question number 4. And Khan Stars to read the question, please.
All of the question number 4. All of the following are high risk surgeries except A, cranial neurovascular. Option B, suprainguinal vascular. Option C, intraperitoneal. Option D, infrainguinal. Option E, intrathoracic.
And your 60 seconds are on your screen.
Inguinal. Option E.
Cool. So I think for this one you've come down the wicket.
Option D. Infrainguinal.
Option D, delta infrainguinal. All right, lock option D then. Yes, That's well played, confidently done, came down the wicket, and I think this is out for a 6 over the long on boundary. Well done. Well played. So we are hoping for a big score. Come on. And question number 5 on your screen.
Question number 5. The surgeon wishes to discuss the option of possibly mitigating the perioperative cardiac risk. Which of the following intervention can possibly help in this regard? Option A, coronary angiogram with view to PCI. Option B, coronary angiogram followed by cabbage. Option C, initiation of beta blocker on the day of surgery. Option D, initiation of beta blocker prior to surgery. Option E, initiation of beta blocker after surgery.
The timer is on your screen.
Option D. Delta.
Okay, so option D, Delta, initiation of beta blocker prior to surgery. Is that right? Should I lock it?
Yes.
Okay, lock option D. Yes, very well done. Well played. We had our fingers crossed that you would answer it correctly, and well done. Another 6 in the tally. Well played. Moving to question number 6.
Question number 6. Given the patient's clinical scenario, what should be further management plan? Option A, pre-surgery EDD. Option B, pre-surgery MPI scan. Option C, proceed with surgery without further testing. Option D, pre-surgery coronary angiogram. Option E, defer elective surgery for 6 months.
Start the timer, please.
हो चुके हैं जिसको प्राइमरी को हुए
Approaching 20 seconds. 10 seconds. Come on. Which option?
Beta answer.
Which one?
Beta.
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 Pre-surgery MPI scan. Pre-surgery MPI scan, option B. Beta, right? Okay. Option beta B. Please lock it. That's another one which is missed. Well. Okay. Moving to question number 7. Be careful now.
Question number 7. Regarding patient's perioperative management of aspirin, which of the following is most appropriate? Option A, continue aspirin perioperatively if possible. Option B, discontinue aspirin 3 days before surgery. Option C, discontinue aspirin 5 days before surgery. Option D, discontinue aspirin 7 days before surgery. Option E, bridge aspirin with enoxaparin.
60 seconds on your screen.
Option C, Charlie. Option C.
Okay, we can hear you better this time. Option C.
Charlie.
Charlie C. Alright, lock option C. They seem to be very sure. Oh, you were confident, but you missed it. Well, that's another miss. Alright. Come on, FIC. Buckle up. And you have question number 8. On your screen.
Question number 8. Which of the following is not an appropriate indication for routine prophylactic perioperative coronary revasc? Option A, left main stem disease in chronic coronary disease. Option B, NST ACS with TIMI score 3. Option C, true vessel coronary artery disease including proximal LAD with ejection fraction less than 50%. Option D, EDD positive for ischemia in stable coronary disease. Option E, NST ACS with heart score 4.
60 seconds on your screen now.
The question, you have problem with
What? Okay, 20 seconds. We can't hear you. Okay, 10 seconds. Hurry up. 7. Which option? 5. 4. Which one? Okay, so I think I would like to take the umpires on board, but I think they said beta. Can we have the umpires'
I think
opinion?
the time had expired.
Okay, so
They were late.
I think she was shouting beta, beta,
yes,
beta.
so that's what I thought as well.
Beta, beta.
Yes, I that's what I thought as well, but I think it's the umpires and the panel's verdict. So what should we do, sir? I think she said beta. That's what I think as well.
Yes, I think let's take beta as an answer.
Okay. So Zak Saab, you're with us, sir.
विजुला साहब ने फतवा दे दिया, मैं कैसे ओवरऑल कर सकता हूँ?
Right, sir. But it's your verdict, which is the final verdict. So.
नहीं सर, मुफ्ती आजम हैं हमारे, वो बुजुर्ग हैं.
Right, sir. Right. So I think the whole panel.
मैंने वैसा सुना नहीं है मैंने, लेकिन.
Right. That's what we thought, sir. So I think.
विजुला साहब, हम पेशावर के लोग बड़े जनरस होते हैं, तो दे देते हैं.
Right, sir. So we are going to go ahead with the answer. So lock option B, please. Oh, it didn't make a difference. They got this one wrong as well. That's for sure, sir. And it's a hat trick of wrong answers.
फितवा भी काम ना है उनके.
Chale, sir, and we are all hoping that they'll come back stronger, especially in the last 2 questions now. So moving to question number 9.
Question number 9. Which of the following landmark trial evaluated?
There is a problem in our internet connection.
Okay, so just hold, please. So you have and what kind of a problem is there? You can't see the screen?
Previously, we can't hear you, and also there is a problem in displaying the questions.
Okay, so can you see it now?
Yes.
Okay.
Shall I proceed?
Right, proceed please.
Question number 9. Which of the following landmark trials evaluated routine coronary revasc before cardiac surgery?
We can't see the question, please.
Okay, so I think we do have a technical. There's something wrong with the internet, I believe. The technical team, please look into it. So, can you see the screen now?
Yes.
Okay, then I think we should proceed. Please.
So option A, CARP trial. Option B, CAPRI trial. Option C, COMET CCS2 trial. Option D, CLEAR trial. Option E, CLARITY trial.
Okay, and the timer starts now. I hope you can see the slide.
कौन से पे लग रहा है?
Okay, so we have 20 seconds, and I believe that they can see the screen now. 15 seconds. 10 seconds. Answer, come on.
Beta.
Capri trial, beta Capri trial. Okay, so they are saying beta.
Yes.
That means Capri trial. All right, lock it, please. Oh goodness, that's another wrong answer. A long series of wrong answers. Well, well, well. With this, we move to the last question of this innings. Question number 10.
Question number 10. What is the clause of indication for proceeding with surgery in patient as per AHA guideline? Option A, class 1. Option B, class 2A. Option C, class 2B. Option D, class 3. And option E, none of the above.
And your 60 seconds start now. Come on, Faisalabad, you can do it. We need a 6 from you this time.
इसका एक क्लास वन भी कुछ ना मालूम नहीं देखना उसको फिर उसे टेक्निक
आपने पढ़ा है सिनेरियो उसका इरेज किया?
मैंने ये सब पढ़ा लेकिन मैं सारी चीजें उसके अंदर आप काम करते एक मेरा
क्लास 1 एजुकेशन।
अल्फा
Okay, so what's the answer?
अल्फा क्लास वन
Okay, they are saying Alpha Class 1. Lock it, please. Oh my goodness. What an ending. And I think they missed all the final deliveries. A total of 5 questions going a begging. And goodness gracious, I think with this we come to the end of the first half, the first innings. And the news is Faisalabad Institute of Cardiology fighters have actually put up a total of 18, which seems to be a low score. Let's see what happens. We do have the panel of experts, and I'm going to move to Professor Mohammad Ishaq Saab. Sir, your thoughts?
Well, I think I'm a bit disappointed with Faisalabad. One or two questions were definitely a bit difficult. I always tried not to include the questions with the percentages, but rest of the questions were not that difficult. But I think it's a very low score, and they'll have to really work hard to come up to the standards of this league. Today, the quality of sound was not very good, so I couldn't hear all of the conversation. But the thing is that definitely it's not a good score. It's a poor score.
Surely, sir. I think we did get marred because of some technical issues, especially in terms of the audio. But I do believe that the team FIC could have done better. But you never mind. You can still put up a fight, and it ain't over till it's over. So with this, I now would like to move towards Professor Hafizullah Saab, sir. Your kind words.
Thank you very much. I think it's a very interesting game, and they are trying their best, and they did try their best. Some of the questions were ambiguous, so it's very difficult to answer them correctly. But I think this is the game, and they are working hard, and the whole idea behind this exercise is to learn, and all of us are learning at the same time. So thank you very much.
Thank you very much, sir. Extremely encouraging words. We all learn a lot from you. I think this league is turning out to be instrumental in teaching everyone at every level. We do have Professor Fawad Farooq Saab, and I think his input is also quite important. Sir, are you there? Okay, so with this, I think we don't have anybody else on the panel at the moment, or do we? All right, so with this, we move to the second half of the game today. And it's 18, the score put up by FIC Fighters and Aga Khan Stars. It's your time now. Let's see how you perform. So can we have the scenario? Please read the scenario, FIC Fighters.
An obese 35-year-old man is seen in the office of chronic progressive dyspnea during physical exertion over the past 2 years. He also mentions occasional lightheadedness precipitated by physical exertion. His medical history is otherwise notable for hypertension, which is well controlled with lisinopril 10 milligram daily. He takes no other medications. On examination, his heart rate is 84 beats per minute, blood pressure is 92 by 60, and JBP is elevated at 10 centimeter. Cardiac auscultation reveals a fixed split S2 with a prominent pulmonic component. His lungs are clear bilaterally. There is 1 plus bilateral pedal edema, and echo is performed and reveals normal left ventricular size and function. The RV is moderately dilated with reduced systolic function.
All right, so Stars, you have a couple of seconds to get ready and then let us know.
Yes, we're ready.
Okay, so can we have the first question on the screen? Fighters, read it please.
Question number 1, which of the following is the most appropriate next step in the management of this patient?
Read the options. Please read the options. FIC. Fighters.
Option A is right heart cath. Option B is cardiac MRI. Option C is overnight oximetry. And option D is pulmonary function testing. And option E is V over Q scan.
And 60 seconds start now. I will request FIC Fighters to read the question and all the options, please.
Anything related to pulmonary or also it does obviously obese, but वैसे का component होगा. That's not something we're looking at. We're looking at the dilated right side chambers and the allowed P2 pulmonary hypertension report. We have to go with the. I think A is gonna give us more information. We will tell us today is done, but I don't think that will fight right now.
25 seconds.
So we will be going with the option A, right heart cath.
Are you sure you want me to lock it?
Yes, sir.
Okay, then lock option A. So you got the first one wrong. Still a lot of questions to go. Think wisely. Question number 2 on your screen, please. FIC to read.
His echo shows PR jet velocity of 4 meter per second and IVC of 22 millimeter with less than 50% of respiratory variation. What is the pulmonary artery systolic pressure? Option A is 64, option B is 69, option C is 74, option D is 79, option E is 84.
Timer starts now.
Option D, 79 millimeter mercury.
All right, so that's very quick. Are you sure? You want me to lock it?
Yes, sir.
Option D, delta. Yes? Delta? Option D, right?
Yes, sir. Yes, sir.
Okay, they're very confident. Lock option D, delta. Oh, yes. Very nicely done. That's quick work. Although I'm sure Ishaq Saab must have had his heart in his mouth. You were too quick with this, but that's out of the park for a 6. Well played.
Well done.
Very right, sir. So I think very, very nicely played. And question number 3 on your screen.
Causes of prominent A wave in JVP, including all of the following except PS, pulmonary hypertension, tricuspid stenosis, aortic stenosis, or ASD.
Timer starts now.
So we're talking about the right-sided problem. The pulmonary stenosis will lead to problem with the increased pressure in the RV, which will lead to increased there. Pulmonary hypertension, which is the same. TS is also equal to the same. ES is also equal to the same thing. So AS is something which is in the later stage, but earlier stage में कुछ so we will be going with option D, aortic stenosis.
Are you sure?
Yes, sir.
You think it's a 6 over covers?
Probably, sir. Let's see.
All right. Lock option D. Oh my goodness. It came in and got your off stump. So, yes. Well, an interesting one, but you definitely, I think, got this one wrong. So, moving to the next question. It's getting interesting. Question number 4.
Which of the following statement regarding ASD is true? Option A is percutaneous device closure of ASD improves the functional status in symptomatic patient and exercise capacity in both asymptomatic and symptomatic patient. Option B, children who have undergone repair of an isolated scandum defect should receive lifelong endocarditis prophylaxis. Option C, murmurs are not typically present in patients with uncomplicated ASDs. Option D, left axial deviation of QRS complex on ECG suggests the presence of a sinus venosus ASD. Option E is none of the above.
And 60 seconds start now. Come on, stars, you have to be careful. It may get interesting. You still need 3 more right answers to win, that is. So we can't see Aga Khan on the screen. I think we need to see the stars on the screen. 20 seconds. Okay, so I will ask stars to switch the mic on, please. 10 seconds.
So we will go with the option A, percutaneous device closure of the ASD improve functional status in symptomatic patient and exercise capacity in both asymptomatic and symptomatic.
So you want us to lock option A alpha. Lock option
Yes.
A then. Oh yes, well done. This one has gone for a 6 over covers. Well done. Well played. So, moving to question number 5.
Which of the following finding would be a question ही शो हो रहा सही से please screen सही करें.
Okay, just hold on. So, FIC, can you see the question?
No.
Okay, so they have some technical issue over there, so I'm going to read the question. So question number 5 is, which of the following findings would be contraindications to ASD closure in this patient? Option A, right ventricular dilatation. Option B, pulmonary artery systolic pressure of more than 80 mm of mercury. Option C, a QPQS ratio of 1.6. Option D, bidirectional shunting. Option E, severe tricuspid regurgitation, and the timer starts now.
A is correct. C is correct. You're sure about it. C, I'm not sure for something in patient heavy and so we'll have with B and D. Severe pulmonary hypertension and then C. And D something which is even
20 seconds.
So we're going with option D, bidirectional shunting.
Are you sure? Option D. All right. So lock option D, please. Oh, goodness. I thought this one would definitely be hit for a 6, but it's missed. A clean miss, I would say. Well, it's getting interesting. You still need 2 more questions, correct answers to win, 1 more to draw. And with this, we move to the question number 6. So FIC, can you read the question?
A primum ASD is commonly associated with which of the following? Option A is cleft mitral valve. Option B is partial anomalous pulmonary venous drainage. Option C is persistent left superior vena cava. Option D is goose neck deformity. Option E is both A and D.
And 60 seconds on your screen now. Twenty seconds. 15. 10. Come on.
So we're going with option A, cleft mitral valve.
Okay, so they want us to lock option A, cleft mitral valve. Lock option A, please. Oh my goodness. Well. You were partially correct, but it wasn't the right answer. Anyhow, it's getting tighter. You just have 4 more questions. You need 2 right answers. Well, let's see. Question number 7.
What sign is seen in which of the following? Option A is partial anomalous pulmonary venous drainage. Option B is total anomalous pulmonary venous drainage. Option C is absent anomaly. Option D is persistent left superior vena cava. Option E is good cardiac syndrome.
The timer starts now. All right. Is this a googly? Let's see. Do they play it well? Let's see. So we can't hear the stars. They should switch the mic on. So the answering team should keep the mic on.
Yeah.
20 seconds. 15. 10 seconds. Come on. 8. 7. 6.
We will go with option B, total anomalous pulmonary venous drainage.
Option B, beta, right? Total anomalous pulmonary venous drainage. So lock option B. Oh my God. I knew it, that this was a googly and you got it wrong. Well, you came close, but I guess a tricky one. But this is where the trick was. All right. So we just have 3 more questions. And with this, I think we're getting down to the wire. We have developed a knack to make it interesting in the end, and we all enjoy it. Please read question number 8 on your screen. FIC, can you read it?
Which of the following statement about ASD and percutaneous closure of is false? Option A, scandum ASDs are the most common type, are usually located in the septum scandum. Option B is sinus venosus ASD are often associated with one or more anomalous pulmonary veins. Option C is septum primum ASDs may be associated ESD. Option D is most ASD can now be closed percutaneously. Option E is scandum ASDs are the most common type and are located in the septum primum.
And the timer starts now.
Most ASD can now be closed percutaneously. Option two, false, but I have to go with the false one. Secondly, this is the most common type and are usually located in the septum primum. So, but if we look at the pathogenesis, इसमें क्या होता है कि septum primum which is the definition of primum ASD, and it does not connect the penetration in the primum ASD.
20 seconds.
We will go with the option A. Secundum ASD are the most common type and are usually located in septum secundum.
Okay, are you sure? Should I lock it? Should I lock it?
Yes, please.
Okay.
Yes, please.
Lock option A. Oh, yes. That's well played. The discussion, I think the whole analysis was very good. Well done. Very well played. And this one is definitely a 6. Well deserved. Especially on this one. And you thoroughly enjoyed. And you just need one right answer. You've got 2 more questions to play for. And we now move to question number 9. And we know that the scores are level now. Alright, read the question.
Spontaneous ASD closure in adults should be considered in all of the following circumstances except option A, asymptomatic and otherwise unexplained RA enlargement, option B, pregnancy and anosmia, option C, UTC over better than 1.5 to 1, and chronic atrial tachyarrhythmia, option C, left to right turn and pulmonary arterial pressure, 40% of the systemic arterial pressure.
And 60 seconds are on your screen.
So we have to pick the wrong answer because we need to. So option C is clearly correct. Okay. Left to right shunting pulmonary pressure करने वाला भी it's correct. Coronary chronic atrial tachyarrhythmias and platypnea orthoplatypnea also documented we do it, and chronic atrial tachyarrhythmias versus asymptomatic unexplained otherwise unexplained RA enlargement. So you have to see the RV enlargement for this. Yeah, you need right sided chamber enlargement.
20 seconds.
Signs of right sided volume overload.
15.
Chronic atrial tachyarrhythmia.
10 seconds. 7. Come on, answer. 5.
We will go with the option D, chronic atrial tachyarrhythmias.
Alright, so they want us to lock option D. Is it the correct shot and the winning stroke? Option D, lock it please. And yes, it is. Very, very well done. Yes, you've taken the game with this. Very well played. I think again the analysis and the way they were discussing was pretty good. And so slowly and steady they've picked up the pace. And with this we move to the last question of the innings and the match. Question number 10 on your screen.
ASD is most commonly associated with which of the following syndrome? Option A is Dyeser syndrome, Williams syndrome, Holt-Oram syndrome, Noonan syndrome, or Turner syndrome.
Alright, 60 seconds on your screen.
Yes, that's true. What's up?
I think we have time. Yeah.
15 seconds. 10 seconds. Come on. 7, 6.
We will go with the option E, Turner syndrome.
Alright. Although this is inconsequential. They want us to lock option E, Turner syndrome. Let's see. Lock it. Oh, you got it wrong. So just got it by the skin of your teeth, I would say. You got the victory. I think it was a wonderful game. So we have the winners today, and it is Aga Khan University Hospital Stars. They did play well. It got interesting in the end, but I think it was well played in the end. So commiserations for FIC fighters, but never mind. I think it was a wonderful game, and better luck next time, and well done to Aga Khan University Hospital Stars. So with this, I think we have come to the end, and now I would like Professor Isaaq Saab to definitely throw some light on the score in the end. Sir.
Thank you, Hamza. Thank you for conducting another very interesting session. Yes, one team has to win, and congratulations to Aga Khan. The other team should not be disappointed or discouraged. It's a learning process. These matches are to provoke and stimulate further studies. One or two questions in each scenario were difficult, but then it was a balance on both sides. So I think on the whole, the matter, the text was very relevant and pertinent, and obviously AKU played slightly better than the Faisalabad, but as Professor Hafizullah has pointed out, it's a learning process. We should continue, and we are also learning. These percentages can be sometimes very difficult and very tricky to answer. So we like our question setters to avoid these percentages. Other than that, I think thank you very much for conducting it in a very nice and pleasant manner. And thanks to all the distinguished panelists and our dear friends who are sitting on the panel and going to give their very valuable words of wisdom. So from my side, thank you very much, and Allah Hafiz.
Thank you very much, sir. It's always great to be amidst the stars and stalwarts like all of you, and I think we are all learning a lot from this activity. And with this, I'm going to turn towards Professor Hafizullah. Sir, your input, please.
Thank you very much. Very nicely conducted. I think you have got a good job opportunity for you if you do not succeed in cardiology career. I think you did an excellent job. My two points which are very relevant. It seems that the young colleagues from Aga Khan are preparing for steps, and perhaps they had not covered congenital heart disease in great details. So that's why some of these questions are very, very easy to answer, which perhaps they had not read very nicely. That's why they couldn't answer. I think it's not their fault, it's the fault of steps. In Aga Khan, they only read what is relevant to them, and that too for the steps in the future. Very nicely conducted, and I think we learned a lot. And I think they should go back and read all these things, and they will probably say, why did we miss these simple, basic questions? But it was a nicely conducted. People from FIH worked hard, and Aga Khan worked very hard. So congratulations to the winning team, but no blood loss for the losing team. Kudos to you and for organizing this program. Thank you very much.
Thank you very much, sir. The pleasure is all ours. It's always great to have you. And I think this was definitely a low-scoring game, though. But I think it became pretty interesting.
I think Professor Hafizullah is going to launch a channel, and he's going to employ you.
Well, sir, I'm really grateful to all of you.
In fact, we can launch a cardiology channel.
I'm all up for it, sir. Why not? Let's do it.
We can,
No, but
we
then
can
the
launch.
competition is very tough. The
That's
competition
called
is
a medical channel. We can
Farooq.
launch one.
But the competition is very tough between him and Fawad Farooq. Fawad Farooq is another very good orator, and he conducts the program very nicely.
That's for sure, sir. I think we all learn from Professor Fawad Farooq. I think he's a star among stars, so it's always great to have him. And I think I'm absolutely humbled by your words. We all learn from you a lot, and I'm still learning things. It's great to be amidst our stalwarts. And I think we also have Professor Qazi Abdul Sabur Saab, so I'd like to take him on board. His views, please.
Thank you very much. I was late. I was busy in PCI. It's a very good initiative by the Wilson Pharma. Other pharmaceuticals are also, you see, doing this type of program. It's a good, you see, make activity. And I just congratulate you and all the team, those who have been. And I hope that in future, all these programs will continue. Thank you very much.
Thank you very much, sir, for your kind words and input. I think we've definitely come a long way, and this activity, it's not about winning or losing. In the end, it's about what we take home. It's about improving every day, and as cardiologists, as interventionists, we are always learning, and we will keep learning. So with this, I think we've come to the end, and we all know that today it was Aga Khan University Hospital Stars who won the game, although very closely in the end. And Faisalabad Institute of Cardiology Fighters, they put up a good fight, and it's best of luck to both the teams in the rest of the tournament. And with this, I'm going to now call it a day, sign out, and hopefully we'll see you all in the next game, in the next match. Till then, it's Allah Hafiz from my side. Stay safe.